Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Christian Lindmark. He's CTO at Stanford Healthcare and Stanford School of Medicine. Welcome, Christian.
Hey, John, thanks for having me.
Yeah, it's good to have you on. Excited to hear about some of the work you're doing with 5G. I think a lot of people are interested in that. But before we go there, tell us a little bit about yourself in Stanford.
Yeah, thanks, John. Yeah, so I've been at Stanford Healthcare now in the School of Medicine for a little over almost 10 years, I guess coming up on nine
Wow.
and a half. I've been in the CTO for the last 8 years. Before that, I worked at NYU Langone in Manhattan for a couple of years. And then before that, I consulted all over the country helping healthcare organizations. So about 25 years in the healthcare space total. Little interesting fact, I live in the Seattle area, always have. So wherever I've worked, I've always commuted. So, I've been as a super commuter, if you will, for most of my life. Um, as far as Stanford's concerned, yeah, I think most people know who Stanford Healthcare is in the School of Medicine. We've got a couple hospitals in the Bay Area, our main campus in Palo Alto, another hospital in the East Bay. We see about 2.5 million patients every year serving the Bay Area primarily, but obviously people come from all over the world to get care at Stanford as well. The School of Medicine, we've got about 2,500 faculty, 2,500 students, and we are, really just focused on training the next generation of physicians and providing world-class research on the School of Medicine side. So it's an amazing place to work, incredible people, tremendously smart people, and a great organization.
Yeah, that's awesome. I was going to ask you which coast you liked better, but it sounds like you like Seattle better.
Yes,
That's so
Seattle's been
interesting.
home, and it is nice. Like this time of year, although we've had an amazing spring, but this is the time of year where it gets pretty cloudy and you're ready for summer. So the
Yeah.
travel's been nice to be able to get away to sunnier spots when the weather's not so good.
That's awesome. The commute to Stanford's got to be better than NYU,
Much better. Same
though.
time zone. Yeah, it's great.
That's awesome. What an interesting experience. And it's funny. I'm in the same position. 15 years ago, I quit the day job and been remote ever since. So, we were ahead of the curve. That's us, right? That's awesome. Well, talk to me a little bit about the importance of connectivity in your hospital and maybe some of the challenges that you faced ensuring that you have high quality connectivity for the solutions that your organization needs.
Yeah, absolutely. So, I mean, I think fixed connectivity. I think we've had no problems with fixed connectivity. I think most organizations that hasn't been a challenge at all. But when you start playing in the wireless space, and whether that's Wi-Fi or cellular, that's tend to be a challenge in healthcare facilities, just given the clinical equipment that's connected, some of the challenges with latency with certain devices on some of those networks as well. The cost of distributed antenna systems, which has been, primarily used for cellular coverage, as well as like ERC systems for emergency radio communications for fire and life systems as well. So there's definitely been challenges there. For us at Stanford, we had to put in, I would say, over the top designed Wi-Fi networks to handle the connectivity needs of our staff, as well as what our patients and family expect, especially in the Bay Area. Our demographic at Stanford may be a little different than most hospitals in terms of what the experience people are expecting when they walk into our facilities. So we've designed very robust Wi-Fi networks to handle those needs. And then on the cellular side, we've been putting in distributed antenna systems now for over 15 years. But I mean, they are extremely costly to put in. You have to negotiate with the carriers for each of the facilities, a ton of room for head-end equipment. And it's really been a challenge just to make sure that, one, you can afford it, you have to maintain it, and then you've got the space for it. So that's probably been one of our biggest difficulties, and was one of the reasons why we started looking at alternative solutions, and how we got on board with a neutral host and 5G solution.
Yeah, that's really interesting to think about your population. They're probably hardcore internet users that need to keep working on their startup even when they're stuck in the hospital. Is that
There's
the
definitely
one?
some of those too. There's definitely some of those too. I mean, but we serve a very broad population as well, right? I mean, we definitely serve all demographics. People think of Palo Alto as being very wealthy, and there are definitely areas that are, but there's also parts of it that aren't. And so we serve all people that come in. But I would say it is interesting, just even the types of devices we use.
Mm,
We use primarily iPhone devices with our staff, where I talk to a lot of
okay.
managers around the country, and they use a lot of Android. But the reason why is I would say 80+% of our population uses Apple just because Apple's in our backyard, and it's just
Mm.
what people are used to. So it is a little bit about the demographics and the location we live.
Yeah, that is interesting. Well, and you're right. I think for every organization, the number of devices that's walking into their organization that want to be connected, and demand as patients that we're connected. Yeah, it's changed dramatically. So talk to me. It sounds like that's what led you to implement the private 5G network. Talk to me more about that decision and,
Yeah.
and moving that direction.
Well, like I mentioned, we'd been putting in distributed antenna systems for quite a while. We actually opened our new hospital in Palo Alto in November of 2019.
Uh-huh.
Massive facility, 800,000 square feet, 368 beds, a bunch of OR space. But I would say the one technology that we didn't put in at the time was 5G. And part of that was at the time 5G wasn't ratified, although there were solutions on the market. The other piece was in California, we have to go through certain regulatory agencies with all new technology and they have to be approved typically 2 years in advance of opening. And there's just no way back in 2017 to know what 5G was going to look like and how to plan for that at the time. So the hospital opened, and we had distributed antenna systems in it. Worked great. We had all the cell phone providers working. But we had another hospital in the East Bay that we had partnered with, Valley Care, which is now Tri Valley Stanford Healthcare, and it was a community hospital, and they did not have any coverage inside their facilities. And so for the last few years, they've continued to say, we need coverage, we need coverage. Physicians, they need to access to their phones. Wi-Fi calling wasn't always working, and there were just challenges there. And so we put out an RFP through our normal means, and the price we got back to put a DAS in was just extraordinary. And we're like, there's got to be a better way. I mean, there's got to be a better way to do this. And so we put an RFI out looking at alternative solutions, and we got some incredible feedback and really realized that this market, it was obviously in its infancy, but it was really starting to take off. And we partnered with a company to put in a neutral host network that's running over CBRS and private 5G. And it really eliminated the need for all of the hardware, negotiating with the carriers.
Mm.
It had a much less density of access points needed for that solution. And it was about half the cost. And so really at the end of the day, we weren't necessarily looking for a 5G network. We were looking for a cheaper DAS alternative, which was the neutral host. And we got that. And in addition to that, we got basically 5G for free. And so that was awesome, and it really made us kind of rethink, how we can actually implement this technology and what use cases we can use it for. But that's how we end up getting where we are today.
So help people understand the difference, right? Obviously, many of us have used 5G on our cell phone. How is a private 5G network different than, say, the 5G that you're getting on your cell phone?
Yeah, so the 5G on your cell phone is coming from the carrier antennas externally of the building, wherever they may have their big massive antennas outside. The private 5G network and CBRS is actually happening inside the building. So we have our own antennas that we're putting in. It all goes back to a head end, but we're actually managing that signal internally, and then it connects out to the carriers. What we found through this as well, which we weren't expecting, but the handoff actually between the neutral host network and the outside world is actually better than the traditional DAS handoff and the outside world.
Wow.
So that's actually been nice for our users as well in terms of the number of drop calls that they receive when they switch from one network to the other.
Hmm. Did you have to hire a bunch of people to support the 5G network, or did you work with outside, contractors or people like that? How did you approach the expertise and talent needed for this?
I'm very fortunate. I've got an incredible team, and the people that focus in this space on my team, Anne Marie Yap and Ian Parker, they are absolutely incredible. And so we actually did this all internally. We developed the
Wow.
RFP, they sent it out, we did the evaluations, we brought people in, and we did the interviews ourselves. And yeah, I mean, we took a little bit of a risk here, right? I mean, we went with a company, and we were really their first healthcare customer.
Sure.
The great thing, they've been an amazing partner, though. They've listened to our feedback. They made changes to their solution. And so it's been a really good partnership. I will say, well, one thing people need to keep in mind as they're listening. So we have T-Mobile and we have AT&T. We just brought AT&T on in the last 8 weeks. We were their first business anywhere in the world to run on this new platform. And we're still working to get Verizon to come on board. And so that is one of the caveats right now, that we don't quite have Verizon there, but we're continuing to work with them, and hopefully they'll come on board soon. But for our users, again, it's been a great experience. And now we're starting to work on what other devices now can we take and move on to the private 5G network. And this is where I really think that the benefit's going to be. So my hope and my vision over the next 3 to 5 years is I would like to move all of our clinical wireless workloads off of Wi-Fi and move them over onto the private 5G network.
Mm.
What that's going to do is it's going to allow me to reduce that Wi-Fi network that I built before, not eliminate it, but I told you I had to build a really, really robust Wi-Fi network. I think now I can just go back and I can reduce my access points by probably a third, which means I'm going to save money on my access point side on the Wi-Fi. I'll have this 5G network, again, at no additional cost. I can run my workloads there. I have a little bit of resiliency in case I have an issue with one network or the other. I could always shift workloads back and forth if I needed to. But we're going to continue to work with our partners on the end devices, trying to get 5G chips provisioned and sent to us. So we're working with a lot of our partners there. The other thing that I wasn't thinking about at the time, and the team really brought this up and thought of the opportunity here, was this is actually a sustainability play.
Mm.
We've been talking about wireless for years, but every building you open, there's tons of wires. Like, we haven't got rid of wires. You have access points, but you still have all these fixed devices that you're running cables to. I really think with the combination of a really robust Wi-Fi network and a 5G network, you can actually eliminate your cabling infrastructure by over 25%.
Wow.
Which means you're eliminating your network infrastructure by 25%, right? You're reducing your cooling needs, your power needs, and your IDF rooms. So I think there's a tremendous OpEx and CapEx savings for organizations as they think about 5G in their environments.
Yeah, that's super interesting to see, well, and I think that's part of the process too, though, that you described. And one of the challenges is making sure they all work on the 5G network and have chips to be able to do that. But that's happening as well. But yeah, you're right. Over time, there's so many savings there. Talk to me more about.
I was gonna say, yeah, John, there's workarounds too. Like, we get dongles, right? And you can plug the dongle into the USB. So there's ways to still do it without having the chip, embedded from
Sure. Yeah, especially laptops and things like that.
Yeah.
That's easy.
Yeah.
Interesting. So, you mentioned that, the users love it. I'd love to hear, tell me more about some of the outcomes and the impacts of having your own 5G network.
Yeah. Well, like I said, the initial use case was really around cellular. So for us, the folks at Tri-Valley have been extremely happy and excited the fact that we've now got, robust cell phone coverage for them in their facilities. Again, now our play is, how do we start moving these other devices onto this network and actually, looking to see, what those benefits are going to be. My hope from our end user standpoint, they're not going to notice a difference, right? We don't have issues with Wi-Fi today, right? So the whole move over to 5G from an end user standpoint, this should be transparent. This should not be an issue for them at all. From the IT standpoint, it should save us a lot of money in terms of the less number of access points that we need to support it. And again, as well as having that resiliency built in. So that's where I think we're looking at the benefits to be, is really more on the operational IT side of things. From the end user standpoint, again, I expect this to be very, very transparent.
Yeah. It's one of those interesting projects where, if you're effective, the user knows nothing.
No, it's funny, being the CTO, I often joke that I feel like we're often the offensive linemen of the NFL. No one knows our names unless there's a flag thrown, right? Unless something breaks or doesn't work, like, most people don't know who the infrastructure team is and all the work that goes on behind the scenes, right? And so we're often the nameless heroes, the infrastructure team is. So.
Well said. Well said. Well, outside of connectivity, which I think, this is fascinating to hear about the 5G network. I think a lot of people are considering it, evaluating it. So that's really helpful. But outside of that, what are some of the other, big IT projects you're working on, or even some maybe that you've completed, and talk about how they're going and what you're working on, so other people can learn from your experience.
Yeah, so sure. So, the 5G project has actually been a lot of fun, is because it actually gives me a reprieve from having to talk about AI. But
we haven't mentioned AI till now. Look at you.
I know. But now that you've asked, so, what are the other focuses? Well, I mean, AI has been, top of mind for the past 18 months at Stanford. And so, we've done a lot of work at the very beginning. We were one of the first organizations to work with Epic and Microsoft to roll out some of the AI features. um, with In-Basket, as well as with the DAX Copilot for our physicians. So we have ambient now in the environment, which they love. So we're seeing a lot of incredible impacts with AI. The other thing that we did, which was really cool, is that my team, they built a secure GPT environment. From the very beginning, we said, "Hey, ChatGPT is not secure, right? If our faculty go and take PHI or PI and put it out there, I mean, potentially it's training their model, and it could be discoverable as well." And so we shut off network access to ChatGPT from the very beginning. And my boss put out a very a tight timeline, but within 6 weeks, we were able to go out and build a secure GPT environment where we gave access to all of our School of Medicine as well as Stanford healthcare users, and they can go out there and play with GPT technology, the LLMs, and we've continued to update it. So now we're running over 12 LLMs in the environment, all of the major ones, and they're doing a lot of research in that environment. They're using it with patient notes, a lot of discovery. And so that's been a big win for the organization as well, just having that sandbox to play in and knowing it can be done in a secure way. We also just finished rolling out or doing our Workday implementation. So that wrapped up last fall, and that was a major initiative. Took a couple of years to work through that full implementation.
Yeah, I bet.
So that was a big success and a big win. We were able to reduce the number of applications in the environment. We got rid of 30 some applications and by moving to
Wow.
Workday, which was a really big win and just a lot better user experience as well. So we're continuing to focus on AI. So a lot of the work that we're doing right now is still AI driven. There's a couple of things that we're doing with Epic and some of our clinical workflows that we're going to be announcing here shortly. I can't say much about them yet, but I think some exciting things are going to be coming out of that as well. So yeah, it's a great time to be at Stanford, and the amazing part of it too is that we have access to all of these incredible folks on the school side, and at Stanford, at just the school, the computer science, engineering teams as well. So there's just a tremendous amount of resources available to us, especially as we're thinking about AI. One other thing that I'll mention too that's really been top
Yeah.
of mind over the last couple of years for us has been sustainability. And we've been one of the leading healthcare organizations focused on how do we create a more sustainable environment. We've been partnering with a company called sustainableIT.org.
Okay.
It's an incredible organization. They actually brought myself and another colleague over to Davos this year to speak at the World Economic Forum. So we got to talk about sustainability in IT, talk about AI, and the work that we're doing. But we're seeing more and more of the benefits of AI. I mean, of sustainability. I think in the past, when people thought about sustainability, like, yeah, hey, it's a great goal, but it's really expensive to put sustainable solutions in place. But over the last few years, we're actually finding that sustainable solutions now are actually cost effective too, as well as doing great things for the environment.
Yeah, that's cool. When you talk about AI, it's interesting that a couple of times you mentioned, working with the partners, Epic, Microsoft. I imagine Workday has a bunch of AI solutions as well, right? You know, is that how you're largely approaching it? Is from partners? I mean, the GPT stuff that you described sounds like it was more of an in-house effort, but how do you balance kind of the AI from partners versus you're right, you're Stanford, you have access to build it yourself too, right? How are you kind of choosing between those two options?
Yeah, so great question. So that's exactly the evaluation we do. So we have three buckets for us. So we have, we build it right internally. We have a buy with Epic or partner with Epic. That's our second bucket because Epic's our EHR, right? So main clinical platform. And then the third is, do we partner with our other vendors as well in terms of, waiting for them to come out with their solution. I think the thing that we're finding, at Stanford, we want to be leaders, right? We want to be innovative. We want to drive. And so we're trying to work with our partners to say, where is this on your roadmap? If you're going to get there in the next 6 months, great. Let's partner. We'll help you get there. If you're thinking it's 18 to 24 months, we're probably going to go on our own and try to build it internally first and be a leader there and just try to drive where this is going. So, we are looking, at all three of those scenarios. I think one of the most important things that we did early on is we created a really good AI governance. So
Hmm.
it's the Data Science Executive Committee. It's led by our CEO, actually, as well as our CMIO. And so any AI technologies that we're bringing into the environment has to go up through this committee for their approval and blessing before we put it into the environment. And they meet on a monthly basis to review all new projects that are coming through. as well as getting feedback and monitoring on projects that we implemented to see how well that they're working and making sure that they're hitting our goals and targets that we anticipated. So I think, putting that into place was really important. The other thing that was developed at Stanford by Dr. Nigam Shah was the FIRM model. And so for any new AI project that we bring in, we look at it through the lens of FIRM, which means is it fair? Is it useful? Is it reliable as a model? That's what the M stands for. So that's the lens that all new AI initiatives are brought in and looked at through. And there's been multiple papers written about the FIRM model. Anyone can use it, obviously, but it was developed by Nigam Shah and his team, and it's actually been a great way to think about AI and how we bring it in, because there's a lot of things that AI can solve for, but there's actually things that may not be beneficial either, right? AI might come in and say, okay, it's doing what it's supposed to do, but there's actually value in what it's doing. And so I think looking at it through all of the right lenses, and I didn't say the word, but a part of that firm model is the ethical lens as well. Like there's an ethical piece to AI, I think, that we all know about, and ensuring that you're thinking about that and not making decisions that may be harmful.
Yeah. Well, I'm glad you said ethical. Now the AI that sees this video will, at least apply that to you.
I hope so.
You just trained the model some too. But, is there an area of IT that maybe isn't getting enough attention and should be, or is there something you're keeping your eye on that you haven't yet implemented and you think, hey, this should get more attention? Obviously you talked about AI, but is there something out there that like, hey, people should be talking about this more?
Yeah, great question. I mean, I think there's two things to look at here. One is, IT is as IT infrastructure, right? And I think in healthcare, it's still a really challenging environment. I mean, there are so many applications in the environment to support all of the unique needs of the different departments. And we have hundreds and thousands of applications. It's crazy. So I think we've got to simplify the environment. I think app rationalization, it's one of the things I talk to my peers about all over the country. We've got to find ways to rationalize our apps and reduce that footprint. We've got to bring costs down. I mean, this is nothing new, but these are areas I think that we really have to focus on. I think everyone's heard. I mean, there's a lot of challenges right now in the healthcare space around cost, right? With the administration and some of the things that are happening and the uncertainties. So we've got to find a way to bring our costs down. And it's hard in IT because more and more departments, if not the entire organization, is dependent on IT being there to lead and drive some of this new innovation. So at the same time, we've got to find ways to bring costs down. I think from a healthcare perspective, when I think about new technologies that I'm excited about, I really think the opportunity there is really for care at home or hospital at home. I think we're finally at a place where the technology is there to support our patients remotely in many cases, not all cases, obviously. I think we've got to work with legislators, though, and the government to figure out how we actually get reimbursed for these models, right? This is the challenge. Like the technology might be there, but if we can't get paid for implementing that technology and taking care of patients in other environments, it doesn't make sense to deploy. But I think, when you think about it, people don't like being in hospitals typically. They want to be home. They want to be in their environments they're used to. They want to be around family. They want to be around friends. So I think if we can get them in those environments, it'll help them out. And I think the other piece for those people who may not have an environment, maybe the elderly, maybe they live alone, whatever it might be, I really think we have an opportunity to take advantage of some of the new AI and some AI agents. I think there's really a chance for healthcare AI agents, nursing agents, if you will, who can actually start to be someone, just a companion for patients to talk to. Even if it's not about things medically, just asking how their day is going, not having them feel lonely. They say loneliness is one of the biggest factors in whether you heal or not. And so having some to talk to. And I also think as part of that, you're going to actually learn more about when we need human intervention with the patient, because they're going to say something that's going to trigger something and say, hey, we need to now get a human involved with them. So we're not there yet, but I'm excited about this. I think over the next 3, 5, 10 years, I think how we get treated for health, for health is going to change dramatically from what we're used to today about having to go to the four walls of a hospital typically for care.
Yeah. No, you're 100% right on the at-home care. I use LEQ with my father-in-law, and he said it's the best girlfriend he's ever had, you know. It definitely helps with the loneliness. It's fascinating to see him use it and how it becomes part of his life in a way
Yeah.
that is beautiful. So
Yeah,
that's
absolutely.
really cool. Well, Christian, we always like to end these podcasts with a little bit of career discussion, career advice. So, what would you say is maybe the best piece of advice you've been given in your career?
Well, I mean, I think there's always the traditional one, your word is your trust, and treat others like you would want to be treated, all of those things. But I, I think there's two of them that stand out for me that are somewhat unique. The first was actually at college.
Okay.
I had to take a science class. I was not a science guy; I was a business major, and I had to take a science class to graduate. And so I took I don't know, I think rocks for jocks is one of them. And I took astronomy for the other one. And the first day of astronomy class, this extremely smart professor acknowledged the fact that 90% of us were in there just because it was one of the easier, science classes to take. And he said, "So I'm not here to make you guys physicists or anything like that." He said, "My best piece of advice to you, and the only thing you take away from my class is there's nothing you can't learn in a long weekend." And he was really talking to us about as you go out into the real world, you start applying for jobs. If you have any experience with anything at all, tell people that you know it and then go study like crazy to learn it. Don't sell yourself short. And I can't tell you the number of times in my career where that's come up where someone says, "Hey, can you do this? Or do you know about this?" I'm like, "Yeah, we do it." And then you go out and you just figure out how to get it done. And it's been extremely beneficial. Obviously, you got to be smart about it. Like, I'm not going to go out there and say I can do something that I know I can't do. But that's been a great piece of advice for me.
Wow,
And
that's
like I said,
cool.
worked really, really well. The other one was my second employer. I was a construction company. I was working in their low voltage shop, and the owner of the company came up to me one day and he's like, "Hey, Christian," he goes, you got 20 bucks?" And I grabbed my wallet out, the owner of the company. I'm like, "Okay," and gave him 20 bucks. He turned around, he said, "Thanks," and walked away. And I was like, what was that about? And the next day he came up to me and he was like, "You probably wondered what that was about yesterday." I was like, "Yeah, I could have used that 20 bucks." And he's like, "I was trying to teach you a lesson. You don't know what you can get if you don't ask. And sometimes if you just ask, you're going to get what you want without any questions." He goes, "You didn't question me. You didn't ask me what I wanted it for. If I would have told you, you wouldn't have given it to me." He's like, "So it was in relation to his company. He wanted me to make sure I was looking out for their interests when we're working on projects, so that if we need a change order or something to ask for it." But again, something else that I've used in my career, if I need something or I want something, the worst someone can say is no. So if you go and ask, you'll be surprised often with the response you get. So I think those are the two biggest piece of career advice that I've got that were kind of unique.
I love it. What great examples. That was awesome, Christian. And I really appreciate you coming on to share about your experience with 5G and even how Stanford approaches a lot of different projects and innovations that you're doing. So thanks so much for taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks, Christian.
Hey, thanks, John. Enjoyed being here. Appreciate it.